We live in a society where some 15% of our population has addictive disease. These individuals generally don't know it until they're exposed to the substance, which will eventually prove their downfall. If the substance is prohibited, most of them won't try it or use it regularly, and the actual number of people who become addicted will be comparatively low. If a substance is freely available, as in alcohol or tobacco or even prescribed opioids, we see the number of people who try the substance rise. And the number of individuals who end up going down the addictive disease path therefore rises as well. Now, we've run this experiment many times, and we know that two of the leading causes of preventable death in our society are drugs with no benefit whatsoever. 500,000 Americans die per year due to tobacco use. 88,000 die per year due to excessive alcohol use. And how insidious an assault this has been, where right under our noses, nearly 600,000 of us die every year due to use of products that have no benefit and enormous burdens of cost and risk. Which brings me to marijuana. Marijuana, as has been said, is a plant with hundreds of molecular components, rather like the willow tree. Now, the willow tree's bark has a component that acts as an anti-inflammatory, very much like aspirin. But we don't refer to willow tree bark as medical willow. We don't prescribe it to patients for their headaches. And we don't find willow trees in the wild to have had their barks stripped by people who then stood nearby afterwards smoking the willow bark as a way of combating whatever inflammatory process they might have. There are three reasons we don't see that. Now, the first is that there's no such thing as medical willow bark because willow bark hasn't been demonstrated in double-blind placebo-controlled studies to have sufficient benefit and absent risk sufficient to be acceptable as a medication. Second is that we have legitimate medications which have demonstrated efficacy for treating inflammation. Medications which are comparatively safe and which have comparatively fewer risks. But third, and perhaps the crux of the matter, is that no one gets high from smoking willow bark. And let me be clear, there is no such thing as medical marijuana. The American Medical Association, the American Psychiatric Association, the American Society of Addiction Medicine are all in agreement. There have been no placebo-controlled double-blind studies demonstrating the plant marijuana to have sufficient benefit and absent risk sufficient to be acceptable as a medicine. What has been legislated into existence in 25 states and in the District of Columbia is not medical marijuana. It is recreational marijuana being said to be used for some other purpose. The dangers and risks of marijuana use are well known by the scientific community, even as they're downplayed by the corporate interests. Apathy, lost productivity, addictive disease, deterioration in intellectual function, motor vehicle accidents, and psychosis in a small minority are all among the negative outcomes, all from a product with no statistically demonstrated benefit. Now, for nearly all conditions for which marijuana has purported benefits, we already have existing medications, safe medications, demonstrated to have value. But people get high from using marijuana. And so they're asking us to bypass the very system that has been in place for many years that protect us from drugs coming to market before they've been demonstrated as being valuable and useful in treating disease. So it behooves us to research the plant to find out if indeed some component of marijuana is found to have value. If so, we can produce it in a form that doesn't have the many risks present with respect to use of the whole plant. And we can do this by following the same path that we follow for development of medications in this country, a path we've used for decades, a path that has been protecting our nation's public health in the process. We can and we should make this process less obstructive in this case, because we do need the robust basic and clinical research to develop more information about marijuana's potential to treat various conditions. The recently introduced MEDS Act, for example, makes sense. It encourages legitimate research for the purpose of producing an FDA-approved drug that utilizes a component of marijuana. And it does this in a constructive manner, as we would for any other medication, as opposed to a destructive manner in which we let loose a psychoactive drug that has enormous potential to harm our public health. And by following that pathway, we'll demonstrate the same concern that we do in all other aspects of our nation's health.